My name is Jeffrey Rennie. I'm your host for the Elevate Health podcast brought to you by MetaGlobo. I have a really amazing show for you today focused on mental health. My guest today is a very special person in my life. She is a psychiatrist in her own right. She's been working as a resident at the University of Tennessee Health Science Center in Memphis in the psychiatry department. She has been a psychiatrist for me my whole life, I feel. Is my sister Jenny. Jenny, thank you for joining the program.
Absolutely.
Perfect. So, I obviously know your story, but for the folks at home, can you talk about your journey and what made you want to get into psychiatry as a career?
Obviously, growing up with Indian parents, everyone wants a doctor in the family. But honestly, though, my parents, they never pushed us. They never pushed you to do medicine. I just genuinely enjoyed it and was interested in it. When I did med school, I always thought I would be a primary care doctor. But then I did my rotations where we try out different specialties, whether it's surgery or cardiology or whatever. And when I did my psychiatry rotation, I fell in love with it. I thought it was super interesting, and it's just never a boring day. I'm not a morning person, but for that rotation, I was willing to wake up early. Like, I was excited to go to work.
It's funny too because we're both in the mental health space. I obviously worked as a social worker and everything. What's particularly about that made you want to pursue it?
I just felt like, even growing up, in our community, it's kind of like a little taboo, I would say.
Yeah.
But seeing people embrace it, and then also seeing how much of an impact you could have on somebody's life by just, simple things, starting medication, going to therapy, it could be life-changing. And I feel like it's actually one of those kind of parts of your health that are so overlooked. But in the same time, it's something that can be like fixed so that you can go back to living that kind of normal life. But we go to a doctor for your blood pressure or cholesterol, but when it comes to how you're feeling, your anxiety, your depression, it's kind of still, there's a hesitation there. So I think it's cool that it can be fixed just like your blood pressure. It might take longer, and it's not like a quick fix like a Band-Aid. But it is treatable.
I would say in general in culture, I think there's always that stigma and taboo that if you have mental problems, you brush it to the side, you don't really talk about it to people. And it's important that we have people that are now making it more of an emphasis and are really trying to push it forward. We were talking about misconceptions. So what are those misconceptions that people have when talking about mental health or going through mental health?
If your mental health is struggling, it's like you're weak, or it's like something that just fix it, and I think that's a very common misconception, and why people don't want to see a psychiatrist or a therapist is because it's like a sign of weakness, and it's like, why aren't you fixing it on your own? But in reality, like we talk about, it's like part of your chemistry too. Like, there's social factors and social stressors that contribute to your mental health for sure, but like there's also things in our brain that just, some people are more prone to it than others. And I think that's a big common misconception, that if you go seek help, that it's like a sign of weakness, and that, like, what are you doing? You shouldn't be on a medicine for this. Just go and be happy. But it's not simple like that. It's just like any other illness that comes about. Veterans specifically, so I work at the Memphis VA as well. A lot of my rotations are there too. So like, that's a great point you bring up, like this PTSD. It's kind of like, obviously I don't want to be extreme, and it's like when someone loses a limb.
No, but seriously though.
But it is something that you live with, and obviously it's not to that extent, but it can be very debilitating. I mean, PTSD specifically, they'll have flashbacks. Any kind of loud noises can bring them back to, their time in the war, in combat. So I deal, like, for sure, it's something that affects you daily. And even if you're not a veteran, I mean, just things that people go through, traumatic events, whether, your childhood. I mean, the things people go through is unreal. It's something that you should seek help for, because we could help. We could try to at least do something to help, with those symptoms, and, try to get back to living a normal life, as close to normal as we can. Depression, anxiety is like rampant. I mean, you're first of all, your body's going through so
many hormonal changes.
Hormones are like just completely changing. You're trying to figure out who you are, And I just feel like, high school, middle school, those are like times when other people, the people around you, not everyone has a great friend group that they could rely on, and then there's bullying involved,
Yeah.
and everyone's kind of self-conscious, your body's changing. So definitely, there's things about their mental health, and then that they're struggling with. And then the problem is, and this is for adults too, instead of seeking help through a psychiatrist or a therapist in a healthy way, seeing their guidance counselor, they'll turn to other things like drugs, alcohol, whatever it may be. And that's not the healthy way of
Definitely
coping with
not.
it.
Yeah, for sure.
So, I think for those young kids that, are dealing with those real, mental health, struggles, a lot of things. So like it depends. Like I feel like where I work at with the VA, there's a lot of substance abuse, a lot of just chronic things with alcohol, cocaine. So
Yeah.
all the good stuff, right?
Yeah, for
so
sure.
that's like a lot of it, and it's unfortunate because like especially with our veteran population, like they did a lot. They served for our country, and when they come back, their resources. They have resources, but it's also like how much mental health resources do they have? And then, they come back home and, they're just expected to just integrate back into normal life when they just went through things and seen things that the normal.
Super traumatic.
Exactly.
Yeah, for sure.
So you just expect them to like, turn a switch and go back to normal. Like no
way,
that's not realistic. And then instead of them, and then there's like the stigma there, obviously. And so instead of going to the proper outlets to talk about it, they turn to like drugs and alcohol and whatever. And we have another hospital called Regional 1 Hospital. That's like our main downtown hospital right in the heart of Memphis. On that hospital, we do get a lot of suicide attempts in the going through like cocaine or opioid withdrawal or things like that, as well as these, suicide attempts. And a lot of it actually is from our, 17 to 25 age range.
Is there something in particular that people are dealing with that's leading to suicide, or is it just varied?
It varies. I think a common denominator is like financial and socioeconomic stressors, of course.
Yeah.
A lot of these people that at least I've seen, they've lost everything. Whether that's their family or they don't have that support, and on top of that, they don't have the financial means of like
taking care of themselves.
Exactly. Family is so important, very important, but not everyone has that. So it's like, what do you do next? And I think in the community, at least in Memphis, and I'm sure in Tampa too, there's just a lot of community resources out there, especially for people that don't have the financial means to access that. So finding a therapist, finding someone in the community that's willing to, help you out and listen to your struggles, and then tackling those issues that are really the root cause is big. So, obviously like financial stressors, finding like shelters and things where programs where they could help you with, accessing like a job or, like a work for home, kind of like those kind of situations, I think is important. The thing is, we're never going to fix anything overnight. With psych problems, it's not like I could just start you on sertraline and you're going to become happy the next day.
There's no magic pill, basically.
Exactly. So when they come in with these like suicide attempts, like obviously we want to get them into a psych facility if they're still having those thoughts, or if they're having thoughts to hurt anybody else, things like that. But the real magic, I think, with psychiatry is what happens outpatient, because we could get you stable, enough in the moment, but like for the long term, the magic is when you follow up with your psychiatrist outpatient and you keep those appointments and make sure that you're taking those medicines and being compliant.
I just go back to my work with like veterans, and just when they would deal with their PTSD, a lot of them would go in and struggle with like fireworks, right? Like 4th of July or New Year's. And is there like for medication, is there like a threshold that you do for like people that need those type of resources?
Well, first of all, the patient should be wanting it, because at the end of the day, like there's obviously situations where we could force people to have meds, and that's a whole other topic. But at the end of the day, when it comes to outpatient setting, we can't force anybody, right? So the patient has to be, in a way, like they have to be kind of have that a little bit in them to be like, okay, let's try, like let's do this. So that's number one. If someone's willing to do it and try, then we'll obviously like do whatever it takes, start medication. And then it just depends on their symptoms. Like if it's depression, your mood has been down and you're having struggle sleeping and things like that. If it's to the point where it's affecting your daily life, and it's causing you significant distress, if it's causing you to, your job is like suffering, your family life is suffering, your relationships are suffering, then of course, yeah, we need to start, we should start medications.
Yeah.
So with the stigma, it's definitely gotten better. I think like maybe 10, maybe 15 years ago, as early as that, even the field of psychiatry itself was like, no one really went into it. Not many people are going to see one. And now, I think we could, like, if there's one positive about social media is that, people are like kind of like championing people who, are aware of their mental health and seek help. And you see that the trend goes up. And even as a psychiatrist, it's a great time to go into psychiatry now.
For sure.
Because like everyone wants one. And it just depends on your city, where you're at. Obviously, I know the resources in Memphis, but every city is gonna have, programs where you could reach a therapist. And I think that's always the first key. Before you see a psychiatrist, most of the time, you see some therapist or you see other folks that or do groups, depending on whatever you're dealing with. And there's community resources all around. And it might not even it can be even simple as like, little exercises that you can do on your own. If you're having like maybe mild depression or anxiety or something like that, where you don't feel like it's necessarily debilitating, but you're having these moments where it's like, man, I'm just feeling down or low. There's like exercises that you can do for yourself, meditate. I mean, there's a lot of things you can find online too. But
definitely, there's a lot of resources online for sure.
Obviously, like being in a Western society, it's great in a way because we're very open to it. Like people that deal with mental health, come, get some help. It's all good. But if we went to maybe some other countries, different cultures, maybe not as open and still, growing to accept that as a, medical illness. So I think that in general, just being in this side of the world is also always great. But that's kind of how the city is. There's like traumas from like violence and things, and that affects people for sure. Substance, drug use, that's very rampant in a lot of big cities. So that kind of affects the patient population we're dealing with.
Yeah.
So those are kind of the things. Like it definitely affects. Oh, definitely like changes in your daily habits, whether it's like your sleep, things that are, when it's to the point where it's affecting your day-to-day normal routine, that's when it's kind of like, maybe we should go see some help. I mean, if it's to the point where your relationships are, going south, or it's being affected, or, your job is being affected where you can't do what you're supposed to do like how you normally would, that's when you should definitely seek help. And obviously the big ones are like if you're ever having thoughts of hurting yourself or anybody else. We always ask our patients every day, we're like, any thoughts of hurting yourself, hurting anybody else, hearing any voices, seeing things that I wouldn't be able to see, any kind of things like that's when you definitely, those are like the big double red flags, like come get some help.
Again, we can always go in and get those supports, but once we don't want it to ever get to that extreme of a point where you're physically harming yourself. So once you have those thoughts, your thoughts can lead to actions, and we really don't want to get to that point, right? So it's huge knowing those signs, it's huge seeing those things.
Mindfulness is important, right? Like whether that's yoga or, I don't know, breathing exercises, taking a moment in the morning. It could be simple as like, grabbing a little treat for yourself at the end of the day. I did it. I had a rough week, but let me get that, McDonald's apple pie or
100%.
something. I don't know.
Shout out McDonald's.
Yeah. Your favorite.
Yeah, that.
But things like that I think is important. Depends on the person. For me, I pray every day, so that's very important to me.
Yeah.
So if you're spiritual, that's something that can help. Talking to somebody, family member, loved one, significant other.
So from an outpatient perspective, are people there for like, do you just have a psychiatrist that you see for years, or is the idea like you have them and you get to a point where you don't need the psychiatrist anymore? Like,
That's a
what's
good question. Ideally, you want to stay with that same provider, because they all know you. Um, of course, we have the records of everything. So if so, let's say I move and that patient needs help still, they could
Mhm.
see the other one, the new psychiatrist, and they have all their record there, so they'll know you. But you build that relationship, right, and they feel more comfortable. So ideally, you want to stick with that same provider. Not always the case, but that would be best. And then yeah, that would be ideal.
So we always have a segment here that we go through fact or fiction. I
Okay.
just give you very common
Oh, you do
things.
segments then?
Yeah, I do say we're
Oh.
we're a very special program now, Jenny. I'm a big timer now, you know.
Oh.
Shannon Sharp, next Shannon Sharp out here. But anyway, like we go in and I just give you very generic psych statements, and you just tell me if there's fact, fiction, or if it's like a little bit in between. Is that okay?
I guess so.
Okay, cool. I guess you have to, right? You have to say yes.
Well, if that's a no.
Well, then that'll be the end of our show, I guess.
No.
Our first factoid, right? Psychiatrists are only meant to deal with people that are crazy.
We don't deal with people that are crazy. We deal with people that are dealing with a medical issue. Something's going on where we could fix that, or at least try to, with medicines, with therapy. So absolutely fiction. You're not crazy.
Yeah.
We just need help, just like we need for other things.
Huge fiction, basically, like, definitely.
Oh yeah.
Okay. Mental health is the same for every person.
No. Yeah, that's fiction, for sure. I think mental health can vary. I mean, there's so much, a range of mental health. Whether it's like we talked about, we could go from depression, anxiety, where we could go to full-on psychosis and mania. So mental health is it's a big range, and that's why I love it. Like, you see so many different spectrums of what's going on, but at the end of the day, you could be, we could get you on, good regimen and get you back to living as close to a normal life as possible, if not better. So, that's definitely fiction.
Fair enough. And then mental health problems are a sign of weakness.
Big fiction. Big fiction. I mean, how ridiculous is that, right? Like, if we talked about someone who's having a cough and something, it's like, why are you seeing the doctor? You're weak. Like, how crazy does that sound?
100%. And it's all about that normalizing, right? Of mental health, not making it so like, oh my gosh, like I'm going to see a psychiatrist or anything like that. So yeah, that's huge. And really, when it comes to everything else, I'm very grateful to have you on the show today. I hope that anyone watching really did get something from this. It's a really big topic, and I'm sure I'll have Jenny on the show another time, going in and delving deeper into specific topics. Maybe talking more about the Memphis scene on psychiatry. But, thank you again, Jenny. And do you have anything to say to the folks at home?
Yeah, I mean, if you're, dealing with whatever it is, don't be afraid to seek help. I think that's the most important thing. Don't be embarrassed. There's nothing wrong. It's not a sign of weakness. Seeking help and getting the help you need is important. And there's nothing wrong with that.
Thank you, Jenny, for joining us on the podcast. Guys, please leave your comments down below. We'd love to hear from you. Again, this is your host, Jeffrey Rennie from the Elevate Podcast, signing out.